Tennis elbow's bugging you, is it? Sometimes they'll call this lateral epicondylitis. Epicondyle is just this bony part that pokes out. These muscles come down and they help you bring that wrist back. They can get really irritated and it almost feels like it's trying to rip that tendon right off the bone. So what we want to do is we want to try and take care of that by treating some of the other areas that could be affecting it. And the first one I want to do is just this inner palm, because if that thumb is pulling down and in, that radius bone is also going to kind of rotate with it, making these muscles work a little bit harder to do their job. So find yourself a ball. I want you to take that ball and just put it on a table and add some pressure with the other hand, and I want you to do some circles and just work around that thumb muscle. Try and loosen that up. So I want you to do that for a minute. It might feel a little bit crunchy as you're going through there. That's normal. So try and loosen that thumb area up. The second thing I want you to do is I want you to find something that you can use to kind of scrape. Sometimes you can do something as easy as the handle of a spoon or even the spoon part. I've got a fancy metal tool, but you can use all sorts of different tools to get after it. And this muscle on the inside of your arm, mine's just a little bit red from working this out earlier, but I want you to kind of work through this area of these flexors. And if you get a little bit of lotion, you can put that right in there. Just a little dab, and then I want you to work either with that tool, even a Sharpie. You can grab a Sharpie and kind of dig back and forth. So that might look like grabbing a marker and just sticking that in there, working that back and forth. Let it glide. Those tissues, the skin might get irritated. Just be nice to it. Don't make it too red, and definitely don't make it bleed. And so work those tissues for a minute or so, and you can dig deep. You can hold and wiggle back and forth, just trying to free that up. And hopefully that flexor muscle, that pronator teres muscle, and those other wrist flexors in there can loosen up, take some of the pressure off the back. Then I want you to go for the back of that arm, especially back towards this elbow. So let's grab a little bit more lotion, put that on your arm there, and just want you to glide that all the way from elbow down to wrist, like that. So I'm just following those fibers. It doesn't take long for those tissues to start looking red. We're trying to break up any little adhesions, get some myofascial release going on there, get some blood flow, realign any of those fibers in there. And then I want you to take it specifically on that spot that's really bugging you. I want you to work that back and forth, side to side, do circles around that area. And we're not spending too long here. We're not going to really make it too irritated. We're just going to get after it so that your brain can recognize that it needs to send some of its healing powers down there to get that a little bit looser. So that's step number 2, is to work some of those flexors and extensor muscles. Then the last thing we're going to do is we want to do some stretches. So with your hand, I want you to either do this on the chair, down here, or up on a table. I want you to bring it back. So bring that wrist back like that. And as you add pressure, if it's tolerable, I want you to try and rotate that elbow in and out like that. And that's going to find the different angles of those wrist extensor fibers. And just go back and forth for about 10 to 20 seconds. Shake it off. Then fingers facing you, going with that palm that way. And this one, harder to do the rotation, so it's more of a wiggle back and forth with your shoulder. Back and forth. I want you to do that for about 10 to 20 seconds. I want you to go back and forth, do that 3 times. So back to here, rotating in and out. And then back to there, rotating in and out. All right, see if that helps that lateral epicondylitis and that tennis elbow feel better.